Hi, this is Dick DeAngelis, and we are here on May the 19th in 2020 with Ginny Hughes. Ginny is, as well as being somebody I consider a friend, she's a director? Marketing director at SunnyBrook Assisted Living here in Fairfield. And I don't know why, but I always say by the new Catholic Church. It's really not exactly by it, but you know, it's in that direction, right? And one of the things on a personal note that I've really appreciated is I got to meet a number of the people we interviewed for some of the history films by connecting with Ginny and some of the residents there. And I think Ginny in general, Fairfield and Jefferson County has been very fortunate in that many of their senior living facilities have not had the awful times that some of the other places around the country have had with this pandemic. And I think everybody has a sigh of relief about that. People that they know there, et cetera, they're concerned. And maybe I thought we could start by you sharing some of the things you're doing in that facility that's trying to ensure that that stays that way. And maybe tell us some of the numbers. Has anyone come down with it? Is it something you're getting a lot of testing done or no testing? Or maybe tell us a little bit about the situation there.
Sure. Our management company, Frontier Management, started us with no visitors, I would say in early March. So they were right on top of it. That's been very hard for everybody, very hard for our families, but no one comes in the doors unless they're another healthcare worker. And everybody who does come to, healthcare workers, when they come to work every day, they're screened. We're all fill out a questionnaire that's fairly detailed now, and our temperature is taken. We take our residents' temperature twice a day to make sure we would catch anything whatsoever. And we have been really fortunate. We have been really fortunate. We're not doing a lot of testing because we don't really need to. And we want to preserve the few tests the hospital has. So we've been no one here has gone to the hospital. We're not going to doctor's appointments unless it's absolutely necessary. Because like the doctor scaled back for the last 6 weeks or so. So we've been, we're very careful. I mean, we're wearing masks, we're wearing gloves. We're not visiting with our family members. Me personally and most of the management staff, we're not going to Walmart. We're not going out to dinner. I try not to leave the county. I don't want to bring anything in here, and neither does anybody else. So
I remember even before that time when things were just kind of getting around that, people would be careful. And we were interviewing someone and we had to wash our hands and come in and then put more hand sanitizer on and really be very, very careful. So I think it was another day or something and everything just stopped. So we felt very happy about that. And we were also very careful as well, even though it was before that time. So we know how careful you guys have been. And I think I speak for everybody when saying, congratulations so far on all the good fortune and I know that everybody's thoughts and prayers are also helping. And but the professionalism of you and your staff has really been something that we're all very proud of. I just want to start by saying, and I know this comes up and you and I have talked about it, but maybe you could clear up a few things just for the audience. There's SunnyBrook Assisted Living is where you're the marketing director. And then there's also SunnyBrook Living Care Center, right? So can you talk, that's where the old hospital was, right?
Right.
So can you talk about the difference? Are you connected in any way? Maybe you could let us know about that.
Yeah, I'm glad you asked because there always is a lot of confusion. There were quite a few SunnyBrooks built throughout the state of Iowa by some investors here in Fairfield. And then they were all sold off. And one of those investors was Betty Howell. So they were all sold off and ours was bought by another real estate company. Then Betty, a few years later, purchased the old hospital and started SunnyBrook Living Care Center. So we are completely separate, but that's how the name kind of has the continuity there. And they're a nursing home and a skilled care facility. So people there, let's say you break a hip and you need to get rehab and you're not ready to go home, you go there to go for skilled care, or like I said, a nursing home. Totally different than assisted living, where people are independent, they have cars, they have pets, they're much more ambulatory, they're really healthier late adults, 80 to 90 to 100, as you know. You met our 105-year-old once, so.
They sing.
They sing, they dance, they do wonderful interviews. They've been in movies.
Yes, they've been movie stars, a whole bunch of them.
So we're separate, and like you said, by the Catholic Church, we're affectionately called Sunnybrook West.
Yes.
To help.
Yes.
And there's Sunnybrook East.
Yes. Well, one of the things that I had heard in the news that just today is that not your place, but the Sunnybrook Living Care Center had one staff member that had tested positive. And I know, isn't it funny nowadays, if I'm riding my tricycle and I go, and he looks at you, he's like, no, I'm just big guy. I always cough when I go uphill. So everybody's like, oh, okay. But anyway, I have gotten in the habit now, if I put I've got my hand sanitizer here, so if I put my face, I'm putting it on, all right?
Yeah.
But maybe you could, did you hear anything about that news? Because I am kind of interested. Of course, everyone is. We're all hoping that we can keep a lid on this, even as things start to open up. So
yeah. I heard, just like everybody else, someone told me there was a press release on KTVO, and now there's one on exploreseiowa.com, and it was put out by Betty, that I believe it's just said an employee tested positive, and they're following all the procedures that we all would, that employee is now gone from the building,
right,
undergoing isolation, and that they notified all the family members. So the contact tracing procedure, I'm sure, to let everybody know. So.
And maybe you could talk about that. Have you been meeting at all with our emergency disaster relief team and all that?
Oh.
And do you have something in plan if something were to happen, exactly what would take place?
Yeah, I think it would be the same procedure they're going through. We do. Chris Estel is just, boy, has public health stepped up with what we're doing now. And she does have a weekly webinar. We do watch the governor. And yes, if we had a case here, everything would change. Right. I mean, right now our residents stay 6 feet apart. Our dining room we've taken over almost the whole entry area. Our beautiful living room with the grand piano is now a big dining room. So everybody can be far apart at their own table.
Right.
Our activities are greatly curtailed because they have to be 6 feet apart.
Of course.
Some of them wear masks. It's not mandated because we don't have a case in the building. But
right.
If it was, then everybody would be isolated in their own room. If the person happened to live at Sunnybrook, we have a separate wing where they would then go into a separate wing, and we would go through all the PPE equipment you've been hearing.
Right.
Where the gowning and the masks, and we've got the shields, we've got everything. So fortunately, we haven't had to go to that point, but we're completely prepared. And we just pray we never get to that point.
Well, again, kudos to you and your whole team there.
Yeah.
For the professional job that they're doing. I know that I think there's a feeling, just like there is with our healthcare professionals, that you guys, it becomes more obvious how you hold our seniors, the older people in our community. In many cases, many of them are people that are former teachers, etc., and now they're there, and you're kind of doing great work in really making sure that these people are as protected as possible in this very tough time. So thanks. I wanted to also kind of ask you about the reopening that seems to be happening. So I'm sure that this is coming up for you guys because around the country in different speeds in different states, etc., people are starting to kind of, I always think of the Wizard of Oz, come out, wherever you are. Some people are slowly creeping out. Are there plans that over a certain period of time, then family members may be able to start coming back? And do you have any timetable on that or what?
No. I mean, we have seen from our corporate office, they have said, here are the following phases we'll go through. We'll let you know when you move from one phase to the other. Okay. Right now, we're still in complete isolation. I suspect it'll be up to the CDC and the governor and, Iowa Public Health. But I don't think we're going to be, we'll be near the tail end.
Yeah. Well, yeah. I mean, and the thing is that I think a lot of people in Jefferson County is such an interesting situation. I know for the longest time we were at 6 people, right? And I think the feeling is just, is the other shoe going to drop? Or is this it? Did we dodge a bullet? You know what I mean? And I don't think anyone wants to be so cavalier as to say, well, it's over, let's come out. But also nobody wants to keep our place shut down with 6 cases or 8 cases or whatever it is. You know what I mean? And keep our whole community shut down. There are a lot of small businesses that are really being affected. So I know that as a community, we're going to work together and get through this. But I think a lot of people are wondering, so you have a phase 1, phase 2, and phase 3 like type of program where it gets...
Yeah, what I saw when I looked at one of the phases was each resident could have 2 visitors a day. So that's wonderful. Oh, yeah. Because we do have people who have 10 kids. So, that'll avoid 50 people coming in at once.
I can think of myself.
That'll stage it, and we'll probably still screen them. I'm assuming we'll still screen everybody for quite a while is our...
Sure.
We just got a new computerized screening system where you have to check in on like an iPad when you come in the door. And, it's mounted to the wall. I think it's going to be there for a while.
So basically you answer some questions.
Yeah.
And I bet you use the hand sanitizer first, then answer some questions. And then
take your temperature,
input your name, etc., and tell them what the temperature was. I guess I don't know. That's amazing.
Yeah,
it is. I don't think anybody expected that this would happen, but it is amazing how quickly we adapt, make changes. I think I'm most impressed by our seniors, and maybe you could tell us a few stories how well they are adapting. If you had any interesting birthdays or anything like that happen?
It's hard. Some days, like, I worked Mother's Day because I wanted to. And it was so hard. It was so hard for these families. But, all day long, went in and out, brought flowers. Okay, I'll take these to your mom. Okay, go around to the window. Okay. Oh, nice. I just ran around both Saturday and Sunday trying to make the connections as much as possible.
Yes.
But, it's so hard, but the family members are so thankful. I mean, they'll say thank you. They understand. But it's getting hard.
Is there anything like this in a teleconference or Connect where some people are connecting with their family members that way?
Yes. So I've been doing Zoom meetings. I brought in my own personal computer so I can give it to a family, leave it in a resident's apartment and still be able to work. So we have some regular Zoom meetings. I've learned how to use a Grand Pad. That one just came in yesterday for a big family. We have a Facebook portal. I think maybe that's what it's called. That's kind of cool. We've got a couple of picture frames.
The one where the camera follows the people, right? If they're moving.
Oh, I don't really know. Yes. I think so. I've seen that from the commercials.
Right.
So I have to learn these because I have to troubleshoot for them. And it's kind of fun. It's really wonderful how quickly the technology has become available to keep these families connected. I mean, it's really, the Grand Pad is really it's the simplest one I've seen. The portal's a little bit more complicated. The Grand Pad is pretty cool.
That's great. Well, these are the kind of things I think I'm hopefully we're going to be doing some history Zoom meetings with people around the community, and we'll let you know. And maybe some people would like to be a part of those. I don't know if you have it where it can be the Zoom can be on the TV, or is it mostly just on a computer screen?
Well, I should be able to just do the HDMI cable and put it on the big television, right? Like we've done before for you.
Yeah, and then if people had questions, you could share those questions or something like that.
That would be fun.
Yeah. So anyway, we would love to be a part of that in terms of Fairfield Media Center in any way we could help, or Fairfield Productions for the films. So the only problem is that when we show the films over there, they usually are packed. Yeah. So we want to be careful of that.
We're still doing exercise twice a day, but we stage it to no more than 10 people so that they're 6 feet apart. You know, we're doing our best to just keep it lively, keep everybody happy, best we can, eating a lot of ice cream.
Yeah. You know, I'm glad you said that about the exercise, because I know my mom's lives in Tucson, and she's with an assisted living program there. And she said that was the most important thing, is for her to continue to get some exercise. And because people weren't going for walks together as much, you know what I mean? They were feeling a little more, that isolation definitely affects our seniors, you know, as much as anybody. And they can't necessarily jump out and go do something. Even me, as big as I am, I can get on my tricycle and maybe go for a ride around the block or something. Yeah. See a few people and wave. I've become that guy, you know. But I'm happy, you know, to be able to do that. But I know our seniors, you know, and they also want to be a part of things. They want to be a part of the graduations and the things like that. But I guess the good news is the graduations aren't even happening yet.
Yeah, so. We did have, this was really touching, we did have a bride and groom who were getting married, and it was, of course, there was only 10 people at the church, but they did come, their grandparents stood inside the door, and they see, I'm going to cry again. They wanted, you know, to see her in the gown, you know.
Oh, how beautiful.
Yeah.
How beautiful. Well, you know, you get to bring a lot of joy to a lot of people at a very special time in their life. We appreciate the work that you're doing, and want you to know that. And if there's ever any news we can get out to people, I think the biggest thing is, I guess, for all the families and the friends, is a little bit of patience. That we're still going to be a little while before they're able to come in, but we're doing everything we can to protect our seniors. So.
Yeah, yeah. And please don't make it be like it's me. It's the whole gang. If it wasn't for our healthcare workers, our nurses, you know, the people who come and cook the food with all their protective gear on, you know, it's really a wonderful team effort. I think for us, we've become a stronger team, and our residents have become more cohesive because they're all each other's got right now. And, you know, they're closer. I think we're 6 feet apart, yelling across the dining room, but I think there's more of a sense of community, like we really are all in this together. And it's been good for us, and we really appreciate the families.
Well, that's so great. That's a beautiful message and way to end our little conversation. Yeah. I appreciate you taking the time with us, Ginny Hughes, and I also hope that you can, from a personal note, send my best to all the residents there.
Yeah. All right. Well, thank you, Dick. I appreciate this.
Thank you. We'll see you later.
Okay.
All right.